Joining me now is Congressman Dave Joyce from Ohio, a state that has been hit particularly hard by the opioid epidemic. He's the vice chair of the Congressional Addiction Treatment and Recovery Caucus. Congressman Joyce, it's great to see you, and I know that this issue is a very, very big one for you. And, you know, I saw your tweet where you said 40 plus states have reported an increase in opioid-related deaths during the pandemic. And you kind of lay out something I've been getting at. A lot of these issues were underlying before, and the pandemic has come on and just aggravated them more. As you kind of look at the dashboard of what our collective response is, you know, what does the private sector need to do? What does the government need to do? What do states need to do? What's on that dashboard for you?
Well, thank you very much for hosting this, Steve. I think it's very important that we have these discussions. If you don't mind, I might touch base a little bit on what you were talking about, Dr. Levine, before.
Sure.
I don't know if nationalizing the idea for help is going to help. I really found that during the pandemic and being at home among people, just having that contact, just having that ability to get online or get on the phone and talk to people. I mean, it doesn't do us any good, whether it's opioids or mental health issues, to have somebody realize that maybe they need to take that first step and get help and then get told that they need to wait 30 days. I think we have to make those things more accessible and be sensitive to the fact that that's a big step for anybody to take. And, you know, I think one of our jobs is very deliberate, is making sure that we get money into the communities that are having to deal with this at that also local level. The police department, the first responders, the mental health facilities, the treatment facilities, because it's an every hand on deck approach, you know, when we're trying to get these things accomplished. And what we can do here is help facilitate the money. As Doctor pointed out, there's been money made available in the different acts that have passed through since the pandemic and prior to that. But it's important that we continue to stay on top of this and continue to take care of those people at home who have to deal with this on a day in, day out basis. My first letter to the White House in May of 2020 was talking about just watching the unfortunate stats increase. You know, we finally had a decline in the opioid deaths and the overdoses. And all of a sudden, you know, it's an uptick that continued, unfortunately. It was exacerbated by the pandemic. That sense of loneliness, sense of being without a job or without a future. You know, they turn to things to relieve that inner pain, that mental pain. And so I think it's important that we continue to stay on that and take care of those folks at home and be able to, you know, especially as employers, create the foundation that people will understand that coming out and talking about these things is not going to be held against them. Matter of fact, a lot of folks will say once treated, you know, they were a better employer and employee, and the employer will say they're a better employee too, because they got that off their back.
You know, Congressman, I know that you're looking at workplaces, you're looking at a lot of things, but you're in Congress. But I know that they're the underwriter of today, and unrelated to that, the Hartford actually did a study that showed, you know, upwards of above 70% or so of employers thought they were stepping forward on mental health, that they had created an environment that was removing, you know, that had removed stigma, that get people to open up. But then when you poll those workers, you know, only, you know, 30-40% of them sort of felt that openness. I'm just interested, you know, I know the federal government, and we all know that the federal government is limited in what it can do, but in providing hotlines or setting messages or setting tones or, you know, raising some of these questions in a way, you know, again, I try to raise this with Dr. Levine, where I see a lot of well-meaning people out there who just don't have the apparatus to know how to deal with people who are suffering. I guess, you know, my real question is, what can we do with employers to help them bridge that gap? And what can the federal government do by way of, you know, talking to John Katko about suicide hotlines and other elements of that picture that we still need to do a lot more?
One thing, you know, Steve, that I would not have been necessarily a sponsor of prior to the pandemic was the idea that broadband would be considered part of infrastructure. I certainly believe that now, because that's one thing we did notice, as I was talking about before, the ability for people to reach out and touch someone, you know, through the VA or other mental health facilities or addiction facilities, just to have that contact with folks. And so in setting up places where, you know, that 15 minutes of walking somebody through is, hey, things aren't that bad. Hey, you know, why don't you call me and I'm going to send you some information on where to find jobs. There's a lot of jobs that are available or help available, and I'm here for you, and call back. That kind of just, reaching out and touching folks, which is so important at the ground level, is something that I think needs to continue to be done by us. And, what I noticed, obviously, when you go by a McDonald's that was closed, but the parking lot was full, the people were all there using the internet, that it was a big problem in my district as well. And you wouldn't necessarily think it in, Ohio, Pennsylvania area, but obviously it's something that needs to be addressed. Just having the ability for people to reach out and contact. That telehealth and telemedicine is something that can only be established by us putting the money to broadband and taking it out that extra or the last mile, as they say, and then using some of our parental pressure, if you will, on corporations to make sure that the broadband that we laid at our expense is brought into that house in a cost-effective manner.
Congressman, you're working hard to pass a piece of legislation called COPE, Comprehensive Opioid Protection Act. What would COPE do?
Thanks for bringing that up. It's important. The idea of COPE was to give those people, as I was talking about, on the ground, the ability to deal with this. Unfortunately, a lot of communities started to see their revenues slip away, and so we don't want them cutting things. We want people to be able to understand, law enforcement to be able to stand wherewithal. They'll have the wherewithal to do the job, and to get folks to come forward and be able to be part of, what we're trying to do here, and getting them better, getting them healthy. And I think it's just so important that when it comes to the COPE Act, that we continue to do the things that are necessary as far as getting in a bipartisan way, getting help to those folks and letting them understand that the COPE Act will bring the necessary funding and help those people on the ground get the education and the training that they need. In my days as a county prosecutor, I can tell you, 25 years of doing it, we saw a change where people, there was no longer the mental health facilities we had in days of old. And unfortunately, our local jails and our prisons became mental health facilities and not doing a very good job at it. So, and a lot of that leads to addiction and the problems that are come with that. So the COPE will allow us to educate those folks back at home and how to use the system in a meaningful way and help those people who need help.
One of the things the Trump administration did, I don't know if a lot of people remember this, the many, kind of fireworks of the last 4 years, but the Trump administration invested heavily in opioid abuse and trying to respond to that. I remember interviewing Kellyanne Conway. We have Jim Carroll, the former director of the Office of National Drug Control Policy, on the program here with us later today. Has there been continuity between what they did and the investments they were trying to make around the nation in the service and support centers? Or do you think the Biden administration is moving in a different direction? And just what guidance would you like to give the Biden administration in terms of approaching this challenge, from the position of the White House?
I go back to my father, and he told me that when being a World War II vet who was shot and left for dead, they didn't talk about it much. And he said they got through because they came home and they went to work. And they got jobs. They used the GI Bill and went to school, went to work. And that there was a certain camaraderie about that they were creating this new world and things were going good in the country. And things were going very well prior to the pandemic. I think, unfortunately for President Biden, he's inherited an economy where things started to slip. And when people don't have a job, they don't have the wherewithal to get out every day and be in their communities and being active and paying for the things that are necessary for them and their family. That sense of depression or loneliness that and especially if one was single and didn't have a family to reach out to, that angst continues to build up, and that leads to either for those who may have been having some instability problems, more mental health problems, or drug addiction too. So I think obviously we need to continue to build on what we're doing and having a strong economy with full employment, getting people the opportunities to work and stay active and be part of something bigger than themselves is an important part of helping cure this, and having employers on board. And I haven't spoken to one employer yet who hasn't thought about ways that they can be helpful or what they can do, understanding that the unfortunate stigma that's around either drug addiction or mental health issues is something that we got to pierce through. And we have to do it in a way that realize that there's nothing wrong with somebody. I have heart issues. I take statin. People have other issues and they take medicine for that. It just is what it is. I got this from my mom. So, you just got to work through some of these things and try to get it in a way that lightens up the conversation that, just because you're having some mental hiccup or an issue at the moment doesn't change that you're still a very good person.
Dave, just real quick. I mean, I asked Congressman Kotko. I said everybody has a kind of story in this realm around them, and I worked in the Senate, as a staffer, and I know storytelling is important, at some level. But I mean, are you invested in this because you yourself have also had personal connection to this? Is that what you share with your colleagues in terms of having them understand the importance of these pieces of legislation and your work here?
Steve, the mental health aspect of this, I saw where so many repeat offenders were coming back in, and when they were on their medication, they were doing fine. The trouble is, they get fined and they don't feel like they have to take a medication anymore. And, over 25 years, you get to see a lot of the same characters. And so the drug court that they established in Geauga County, it went back, their first graduate, the guy went back so far. Hell, I was his public defender. And then I was a prosecutor. I knew his father, I knew his whole family. And it took 20 some odd years for this kid to finally get on the straight and narrow. But having people stand there and having the apparatuses in place for them to do that are very important. I've watched my kids' friends, unfortunately addicted, and a couple of them pass away. My wife's nephew passed away from overdoses. They were all good kids, just got caught in a bad situation that was bigger than them. And the drug itself must be like the devil itself, because it certainly, we found something that actually breaks maternal bonds. So it's got to be hell for anybody who gets addicted to it to try to get themselves off. So I think we have, from law enforcement, again, we try to arrest our way out of some problems, and that's not the treatment for opioids or mental health. We have to understand and work with the problems and realize that, unlike alcohol, where it was a 28-day program and then all of a sudden, boom, back to work all is well, that's not the same here. This is a really long-term problem with opioids, and God forbid they, in their chase of opioids, end up with fentanyl, because what they took one Friday, the next Friday may kill them.
Yeah, well, that's absolutely right. Representative Dave Joyce, Vice Chair of the Addiction Treatment and Recovery Caucus in Congress from Ohio. I really appreciate your candor and thoughtfulness in dealing on this topic. Thanks so much for joining us today.
Steve, thanks for doing this. It's a very important thing that you're doing here, and keep on doing it for us.
Thank you, sir.